The webinar is started. Natalia, you can start.
Good morning, dear parents. Thank you so much for joining in today, and welcome to our awareness webinar on taking care of cancer, its treatment, understanding what it means as a family to deal with cancer. Before we start off today, I would like to introduce you all to Dr. Vishwanath. Dr. Vishwanath is a highly esteemed senior consultant medical oncologist and academic advisor at Apollo Hospitals, Bangalore. He completed his medical training and MD in general medicine at Kasturba Medical College and earned his DM in medical oncology from the prestigious Kidwai Institute of Oncology, Bangalore. He also pursued a clinical fellowship at the MD Anderson Cancer Center in the US. He has extensive experience in treating various cancers, including lymphoma, multiple myeloma, leukemia, breast cancer, head and neck, gastrointestinal cancers, as well as gynecological cancers. His remarkable contributions to oncology are reflected in over 45 internationally peer reviewed publications. He has been recognized with numerous accolades, including gold medals in MD Internal Medicine and DM Medical Oncology, the ASH Merit Award, and the Promising Young Clinician Award from Apollo Hospitals. In December 2024, Dr. Vishwanath was featured in the President's Corner of the American Society of Clinical Oncology Connection in an interview with Dr. Robin Zorn, the president of ASCO. Beyond his clinical work, Dr. Vishwanath serves as a managing trustee of the CPOM Foundation, which is a nonprofit organization dedicated to promoting education for clinicians, patients, and caregivers. So, just to give you a brief about the CPOM Foundation, it is a nonprofit organization which is dedicated to educating the public about cancer, its treatment, and care. The CPOM Foundation collaborates with some of the world's top oncology centers to develop videos and educational material programs and host webinars on various topics related to cancer and its care. So, Dr. Vishwanath, welcome. Thank you so much for joining us today and looking forward to the session on such a crucial topic. Over to you, Dr. Vishwanath.
Yeah, sure. Thank you, Natalia. Second, let me share my slides. Yeah. Yeah. Good morning to all of you. Thank you, in spite of your busy schedules and your family time on a Sunday morning. Thanks for joining in here for this talk on empowering families through cancer awareness. And I would like to thank the leadership of AKR Schools for this wonderful opportunity. And today I'm not going to give a run of the mill talk as an oncologist to my fellow healthcare professionals about cancer. It's going to be a different conversation about cancer. First of all, I'm a parent and an oncologist second. And of course, I try to bring a unique perspective to this conversation about our health challenges and how we as families can support each other about and how to empower each other to early to diagnose cancer early, which is and then build a community to make sure that we have a better place to live in. That's the whole idea, and I want to give a different spin to this talk rather than just talking about all the negatives about cancer. And we all know knowledge is superpower, and understanding about cancer and knowing more about it will only help us rather than and also allay the stigma and the fear which most of us have about this deadly disease. And we are not alone. Each of us have our family members and the entire community as a support. And this understanding is going to go a long way in in educating ourselves and educating our families, colleagues, friends, our children about this disease, and making sure that we all help each other in diagnosing this disease early and also inch towards cure. So it's going to be a journey for together, and it's not about one person, it's about all of us together. And So it's all about understanding the basics of cancer, and then how we recognize the symptoms and signs, and also a few words about prevention and the family, and what we can do as a community as a whole. Sorry. Yeah. So, why do we get cancer? Cancer is nothing but when the health, we have a lot of immune surveillance, and there is a lot of homeostasis, which our body is so complex, and there's so much of homeostasis, and the body's immunity takes care of all the germs, just like infections are taken care of. Similarly, it takes care of, it evades all the cancer cells. But certain mutations or genetic defects which can happen due to various reasons, it could be environmental factors, it could be any of the risk factors. So there are certain non-modifiable factors like genetics. Uh, Due to these, there will be certain genetic defects in the normal cells, and that's how we these healthy cells turn into cancer cells, and they start multiplying too fast and too much, to make it very simple. And these additional cells, cells will become lumps and then tumors, and then these tumors, when they become malignant, it's called as cancer. So cancer starts in various parts in any part of the body, and we have certain common cancers like the breast cancer, cervical cancer, lung, head and neck, prostate, intestine, and each one has got a different treatment. And over a period of time, if we miss the bus, that's when we get what is called a secondaries, and the disease starts going to the other organs, and it metastasizes, and that's when we get the stage 4 cancer. There are certain common cancers in India, and not to make this talk very worrisome or alarming, but just to understand that most of these cancers have some kind of risk factors. For instance, you talk about lip and oral cavity, which is one of the common cancers in males in India. Smoking or smokeless tobacco, what we see, chewing gutka, is one of the common causes of this lip and oral cavity cancer, and it can be preventable. It is preventable, and it is one and most common in males, in 15.6% in males. And then we have breast cancer, which is most common in females. And these days, we are seeing, once upon a time, it was a disease in the postmenopausal women, usually occurring in women over the age of 50. But these days, the trend has changed. There's a paradigm shift, and we are seeing women in the ages of 30 and 40s developing breast cancer. Why is this happening? It's probably because of the environment. Women are getting married over the age of 30. The first childbirth is over the age of 30. Some women tend not to have children, and the exposure to estrogen due to various environmental factors, and the lifestyle choices, and the dietary factors. There is early menarche, the early onset of menstruation, and delayed the pause of menstruation, which is called menopause. That period where the body is exposed to so much of estrogen, these are all the factors which are probably modifiable, and that's one of the common causes of cancer in India, which is breast cancer. And then lung cancer, once attributable only to smoking, these days we are seeing non-smokers, men and women, develop lung cancer, probably because of the environmental factors. We've seen Delhi, there's so much of pollution. So can we do something about it? Our policy changes. So all these things, it's preventable, and just goes to say that the common cancers are, most of the risk factors are modifiable, and we can go there. We can probably get to the root of these problems and try to prevent these cancers. And cervical cancer, again, the second most common cancer in females, comprises around 10% of all the cancers in women. And you can see that cervical cancer is mostly preventable by the HPV vaccination, which we will talk during the course of this talk. And then there are other cancers like the colorectal cancer. We have screening modalities for that. We'll talk about that. And then ovarian cancer in women. So overall, in a nutshell, if you see, most of the common cancers are caused by certain modifiable factors, and we can talk about certain lifestyle choices and other modalities, how we can prevent it. So talking about risk factors in cancers, broadly, cancer risk factors are divided into modifiable and non-modifiable. There are certain things which you cannot change. One is the age. As you age, you get cancer, but over the age of 70 or 80, People tend to get cancer, and these days we have wonderful modalities of investigations and treatment where you could probably live with cancer, and it's probably the new diabetes and hypertension. You swallow a pill and then you live long. And then you have lifestyle choices. Um, Tobacco, so this is something which you can prevent. Abstain from tobacco. And the most important thing about tobacco is that you smoke and then you stop smoking, your risk does only mitigates, but it does not come down to zero. So it's very important to be a never smoker or never touch tobacco smoke. And if any of you or anyone who's smoking, please abstain from smoking today. And then alcohol, if you see the recent guidelines issued by the US surgeon, the Indo-American surgeon, Dr. Vivek Murthy, he did say that no amount of alcohol is actually beneficial for anything. And even a small amount of alcohol is carcinogenic. So it's very, very vital to abstain from alcohol. And then dietary factors, you have, of course, right from the childhood, eating a lot of junk food and pizzas, burgers, oily food, diet rich in, saturated fatty acids, and a lot of red meat. All these are detrimental and can be carcinogenic. And probably the food which is very fried and a lot of Ajinomoto in the food. These things are probably detrimental, and we should talk about during the course of this talk. I'm definitely going to talk about how we can, as a family and community, do something about eating healthy. And then exercise. So if you are having a very sedentary lifestyle, again, obesity can be a factor, because once you are obese, there are certain inflammatory markers which get released in the body, and though that inflammation can again be carcinogenic and can cause cancer. And environmental factors, I don't know where to start from. All our urban setups are, so much of smoke and pollution, environmental hazards, workplace hazards. The only thing probably we can do is people who are working in this, as at least in the occupational places where there's increased exposure to, say, carcinogenic smoke, like, say, asbestos or benzene. Probably they can use N95 masks, which could go a long way in reducing the exposure to these carcinogens. And then we have certain infections. So you can never undermine the cause of infections causing cancer. You have certain viruses like hepatitis B, which is preventable. You have vaccines against hepatitis B. And once you take these vaccines, you are immune from having a liver cancer due to hepatitis B, which can cause a chronic liver disease. And then certain other cancers, like the cervical cancer, where HPV vaccine, a simple HPV vaccine, can prevent cervical cancer. So it is of paramount importance that we educate ourselves and educate others about these infections, which could possibly be prevented and which can reduce the burden of these cancers. And then we have certain socioeconomic factors. We have lack of screening. One of the most important stigmas about screening is, the fear about being diagnosed with something. And then the awareness. People are not aware in the rural setup. And in India, there's so much of unequitable distribution between the urban and rural setup. Individuals in the rural setup are not aware. And then, of course, most of us pay out of pocket. Insurance is limited. And we talk about screening. People are worried about spending out of pocket to come and get the screening done against these common cancers. So, but what we have to understand is these screening modalities are very cheap, and we have to allay the stigma, remove the stigma, and we have to probably educate the communities about screening so cancer is diagnosed early and then possibly curable. Let's talk about common symptoms. If you talk about oral cancers, any oral sore which is not healing, difficulty in swallowing, and men and women can develop. So these symptoms are probably warning signs. And breast cancer symptoms, it could be just a simple lump in the breast, or it could be changes in the skin over the breast, or some nipple discharge, bloody discharge. These, or a swelling in the axilla or in the underarm. These things point towards a possibility of breast cancer. But what we have to understand is that 90% of the lumps are actually benign, they're not cancerous. But a simple visit to your healthcare professional is going to do no harm. It's only going to allay the anxiety. And then lung cancer. It could be subtle or patients can present with persistent cough, blood in the sputum, chest pain, unexplained weight loss. Never ignore weight loss or loss of appetite. And then men over the age of 50, men who are having increased frequency of urination or urgency of urination or backache, please visit your healthcare professional to rule out a prostate malignancy. And then cervical cancer, which is one of the common cancers in India, women generally over the age of 50, but these days we're seeing younger women presenting with irregular bleeding, postmenopausal bleeding, pain during sexual intercourse. All these are symptoms which could be attributed to cervical cancer. And then stomach cancer, patients usually present with loss of appetite, loss of weight, and they could have bleeding and pain abdomen. So these are all the warning signs for stomach malignancy. But a rule of thumb, uh, any individual having a chronic weight loss of more than 10% of body weight in the last 6 months, unusual bleeding or bruising from anywhere in the body, any persistent pain, it could be backache, belly pain, chest pain, changes in skin color, or a mole which is becoming big, changing its color, changing its pigmentation, and changing the texture, it's becoming thick. Please visit your healthcare professional. Similarly, a persistent cough or hoarseness, difficulty in swallowing, any lump in the neck, lump in the underarm, lump in the breast, please visit your healthcare professional. A non-healing sores, any sore which is not healing, there's no harm in visiting your physician and just getting it checked. These are all the simple things which we can do as individuals and help our fellow human beings. If somebody talks to you, please educate them about visiting a healthcare professional. And how do we investigate? So, initial assessment, not every patient comes to an oncologist. Please visit your physician. We generally are probably at the end of the probably the pyramid, where we see only patients who are diagnosed. Please visit your local general practitioner. The practitioner would do a physical examination, take a thorough medical history, discuss the symptoms, and do some basic blood tests. There are certain tumor markers which can probably detect blood cancers like colon cancer. There's a tumor marker called CEA. Similarly, ovarian malignancy, there is a tumor marker called CA125. And do some basic X-rays, chest X-ray, ultrasound, which is not going to do any harm. And then once the patient is having a high suspicion, that's when probably the patients are referred to an oncologist like myself. And what we do is we do certain other tests like CT scan, MRI, or we do what is called as a PET scan, which has become a single point, 1 point investigation these days. So it's a whole body scan. It exactly tells us where the disease is and how active the disease is. And then we know that cancer is always a tissue diagnosis. We have to do a biopsy. There's so much of myth around this. People think getting a biopsy done spreads the cancer. Please do not think that cancer spreads with a biopsy. So doing a biopsy can go a long way in diagnosing cancer or ruling out cancer, because ultimately cancer is a tissue diagnosis. And then these days we have entered an era of personalized medicine. Every patient is not treated the same way. It is personalized and precision oncology, tailor-made treatment for each patient, because we do what is called as RNA sequencing on the tissue or in the blood, which is called next generation sequencing. Certain mutations or genetic defects may be present in certain patients and may not be present in the rest. So there are certain targeted therapies or oral pills or magic bullets. For example, a stage 4 patient with lung cancer. Patient A harbors a mutation called EGFR in his tissue. Patient B does not. Patient A is treated with a simple oral pill and lives long with minimal side effects because it goes and targets only that particular mutation. That's the beauty of 2025, treating with targeted therapies or oral pills or magic bullets. But patient B may receive chemotherapy or immunotherapy because he does not harbor any of these biomarkers. That's the beauty of precision medicine. And then, like I said, continuing from the last slide, you diagnose early. We know we can remove that organ. Breast cancer diagnosed early, you can just remove the lump. And then early stage breast cancer, 95% cure rate. It's just like any other disease, any other non-communicable disease like diabetes or hypertension. And then you can supplement it with some radiation or chemotherapy. And these days, like I said, we have these magic bullets, targeted therapy, which goes and specifically targets certain genes which may cause cancer. And immunotherapy, since 2016, it has kind of revolutionized the treatment, since Honjo and James Allison from MD Anderson Cancer Center came up with this wonderful immunotherapy or immune checkpoint inhibitors, which modulates the body's immune system to kill cancer cells. So with a range of treatment options, we have tools to effectively manage and fight cancer, improving outcomes, improving quality of life, and probably making cancer history. So please understand that we have multiple modalities of treatment. And like I said, precision oncology, targeted therapies, molecular testing, monitoring response to treatment. It's really exciting time for oncologists because we are inching towards cure in several patients with cancer. And talking about the survival, long-term survivals, even patients with stage 4 patients diagnosed can survive long. And when patients are diagnosed early, of course, the survival is just exponential, and most of them are curable. And these days, and now as we are talking, in 2020, if you see, there are 17 million cancer survivors, and the list is just growing and growing. We're able to cure so many patients with cancer. And looking at childhood cancer, 90% of the childhood cancers are actually curable. So I want to give a different spin as far as the statistics is concerned. You diagnose cancer early, breast cancer, cervical cancer, colonic cancer, most of them are curable. And we are able to double the survival rates with the current modalities of treatment, including the targeted therapy and immunotherapy. And we have certain curable cancers like lymphoma, which is a cancer of the immune cells. And we have the chronic myeloid leukemia. Since 1996, we got this magic bullet called imatinib, and it's only available for 4,000 rupees for 30 tablets. I still remember my uncle, my mom's cousin, in 1996. He succumbed to the CML. And now we have this wonderful drug, Magic Bullet, for this 4,000 rupees, make in India, a biosimilar, and we're able to cure this condition. That's the beauty of advancement as far as where we have reached with cancer treatment. Talking about screening, what is screening? Screening is nothing but doing certain tests, even before on individuals, before symptoms appear, and making sure that most of these patients are treatable and curable. And talking about breast cancer, we are talking about an average risk woman over the age of 40. Please do breast self-examination every month. There are YouTube videos available everywhere. Please go ahead and get your breast self-examination done, usually the first week after menstruation, and also consult your healthcare professional once a year, because the examination by a healthcare professional will be much better. And most importantly, get a mammogram, which is a simple X-ray of the breast. There are so many myths around mammogram that it is harmful, it causes cancer. I would like to dispel all these myths, nothing like that. And please go ahead and get your mammogram done every year over the age of 40, and it could go a long way in diagnosing breast cancer early. And like I said, most of them will be curable. Cervical cancer vaccine, cervical cancer screening, women over the age of 21 till 65 years, every 3 years, please get your pap smear done. It's a simple test, pap smear, simple test. It can be done even in the rural setup, does not cost much. And please supplement it with the 5-year HPV testing, or also called as human papillomavirus testing. Prostate cancer screening, over the age of 50, men should undergo this PSA testing, which is a simple blood test, and also go to your urologist to get a simple per rectal examination, which will look at the consistency of the prostate. That way, we know that we are not dealing with any prostate cancer. And colorectal cancer, probably once to consider the disease of the West, with the advent of the westernized diet, we're seeing that the incidence of colorectal cancer is increasing in India. So over the age of 50, please go ahead and undergo a colonoscopy once a year, a simple endoscope which looks into your large bowel, your intestine, no harm done. And once it is done, you can get the next one done after 10 years, because it takes 10 years to develop, to get a colonic cancer. Once it is normal, once your intestines are normal, the next test can be done 10 years later. Lung cancer screening, it's not for everyone. Only men who have been smoking, men or women who have been smoking for the last 20 years and who are over the age of 50, they are the high risk category, should undergo what is called as a low dose CT scan. Please consult your healthcare professional for further details. And of course, there are certain things which we can't change. 5 to 10% of the cancers are genetic or familial association is there. We know the BRCA1, BRCA2 genes. We know the famous Angelina Jolie story. In 2013, she decided to undergo a bilateral mastectomy or removal of the breast after she was detected to have this BRCA1 mutation, and her mom had breast cancer, and she succumbed to it. And just by getting her breasts and ovaries removed, she had a 90% reduction of getting breast or ovarian cancer. This is called risk reducing surgery. And then please consult your genetic counselor for this, because that's when we can take the right decisions for individuals who have got any kind of family history, and regular screening, personalized screening, those who have got family history. And of course, it goes without saying that you have to maintain a healthy diet and avoiding tobacco and limiting alcohol consumption. So it is a story of progress by doing mammogram, colonoscopy, pap smear, PSA testing, low dose CT scan. We are able to cure a vast majority of individuals with any of these common cancers. In fact, the COVID is the good story. 75% of our patients who do not undergo, most of them don't undergo screening for lung cancer, and we see 75% of our patients having stage 4 lung cancer. But what happened during COVID? Patients were getting CT scans done for COVID. And we saw that patients had incidentally diagnosed an early stage lung cancer, and COVID led to a cure of lung cancer. This goes to say that individuals who are at high risk, especially chronic smokers and over the age of 50, please consult your healthcare professional for a low dose CT scan. So it's all about helping each other. See the empathy that we all know that most of these conditions, it's not only cancer, it takes a huge emotional toll on patients and families. How can we help each other? Share your stories of hope and survival. Patients who've got cured, share your stories with others. A strong support group. It's all about knowing, letting a patient know that you're not alone. We are all there with you. Seek counseling, communicate, join support groups. This is where we can empower families and communities, help each other, and which can go a long way in making this world a better place to live in. And how parents can make a difference. This talk was mainly to educate. I myself am a parent. I don't know if I'm doing justice to my daughters. My wife is, of course, for sure. So encourage balanced nutrition, promote regular physical activity, make sure that they're protected from sun exposure, avoid secondhand smoke. We all talk about smoking. There's something called secondhand smoke or passive smoking. So how do we prevent that? Make sure that your children are not close to somebody who is smoking. And then there's something called third hand smoke. Somebody smokes, goes out of the room, and then you come in. There's carcinogen everywhere. So prevent that. So this is where, education is important, and preventive. Prevention, of course, is better than cure. HPV vaccine against cervical cancer, age 9 to 26. And then hepatitis B vaccination is part of the Indian pediatric schedule. Every child has to undergo hepatitis B vaccination, which can go prevent hepatitis B induced cirrhosis and liver cancer. Regular health checkups, reduce screen time. We don't know about our mobiles. Cell phones have just come in probably like 15, 20 years now. And we don't know. So obviously better reduce screen time is always good. And cancer education, age appropriate health tasks and talks and body awareness education, family health history, early warning signs. Educate your children about warning signs over a period of time. So they know about all this. And there are a lot of things, fun things you can do together, and you cook nutritious meals and educate children about fruits and vegetables, go shopping together and shop all the nice stuff, and probably cook all healthy recipes together, and maybe have a dedicated family workout time, and play together outdoors, and build a very healthy environment as a family. So I think you can do a lot of things as a family, which can probably you know, bring that positive outlook. Not it's not only about, it's all about health is more about the mind, body, and soul. It creates a very positive mind, body, and soul. And talking about diet, fruits, vegetables, lot of antioxidants, whole grains, and then avoid processed food, red meat, added sugars, and eat a lot of berries, leafy vegetables, cruciferous vegetables. At least 150 minutes of moderate activity or 75 minutes of rigorous activity weekly. And what exercise does, it brings out endorphins, it reduces the inflammation. So this again becomes totally anti-carcinogenic. And then your habits, you have to keep away from smoke, tobacco, alcohol, and junk food, and preventive vaccines, like I said, and yoga, quality sleep. We always undermine the importance of sleep. Sleep hygiene is very, very important with the busy work schedules and even children. It has to start young. We have to make sure that there's good quality sleep, balanced nutrition, stress management, meditation, exercise. I think we can just go on and on to maintain an optimal health and make sure that there's a positive cycle of well-being. And it's more about awareness to empowerment. Raising awareness has to start in the childhood. Fighting stigma for better screening has to start in childhood. And share your stories with others. So others will know. Knowledge sharing is very, very important. And of course, our children are all going to be future leaders. And they are probably going to bring out all these the positive changes and be the advocates for this. And as part of the CPOEM Foundation, which stands for the Creative Portal for Oncology Education and more, we have reached out to families and communities. We have a cancer support group program. And then we have also developed a multilingual educational program where we, in simple different languages, we try to educate the public. It's all available on our website, cpoem.org. And also awareness campaigns. All these, India has a population of 1.4 billion. And we are such a beautiful country. Our country is such a beautiful country that there's so much of penetration of social media and of course the mobile. So people at one click can look at websites, and there's so much of knowledge sharing which happens so easily. WhatsApp is penetrated so much. So why don't we use it for positive things? So there are certain, I would like to conclude my talk with the last few slides. And there are certain myths about cancer, that cancer is always fatal. Please, at the end of this talk, I don't want anyone to go with this kind of a message. Cancer is treatable. Cancer diagnosed early is curable. And cancer surgery spreads cancer? No, not at all. In fact, cancer surgery can only cure this condition. It cannot spread this condition. Cancer is contagious? Please, no. The answer is a simple no. It cannot spread by contact. It cannot spread through physical contact. It cannot spread through casual contact. Only smokers can get lung cancer. That is again a myth. Non-smokers do. 4 out of 10 patients these days, we are saying non-smokers, probably contributed by our environmental pollution. We need to do something, not only as an individual, but as a community. And also our policymakers have to come up with something dramatic. And sugars feeds cancer. Of course, moderate sugar is always good for weight, not only cancer, it's for all the other conditions, including diabetes and your coronary artery disease, any of the non-communicable diseases. But there's no direct correlation between sugar and cancer growth. Stress causes cancer. Yes, stress could may weaken your immunity. Stress is not good for various diseases, but there's no direct connection between stress and cancer. To conclude, I like the saying by our current president of ASCO, American Society of Clinical Oncology, Dr. Robin Zahn, and my mentor. And she said, together we are stronger than cancer. And empowerment comes from knowledge, support, and resilience. And though cancer is a formidable opponent, I think we are formidable too. But with the right tools and support, families can navigate it with strength and support. Early detection can save lives, can cure cancer. Medical advancements means better outcomes. And we as families are a pillar of strength. Please support each other. And community support is very essential. And I would like to conclude with extending a heartfelt gratitude to Ms. Trishta Krishnamurthy. Thank you so much, ma'am, when I came up with this idea, and thanks for supporting this. And Ms. Asha Doris, principal of AKIA BTM, who has always been a pillar of support, Ms. Natalia and Ms. Aruna for facilitating everything. And also my sincere thanks to all the parents from AKIA School for your valuable support and for your participation today. Thank you so much, and I'm happy to answer any questions if there are.
Thank you so much, Dr. Vishwanath, for that wonderful session. I think really did a great job at sort of addressing some of the concerns that we had, as well as dispelling a few myths. So I'd like to open up the floor now for questions. If any of the parents have any questions, you could please raise your hand, and then Dr. Vishwanath would address them.
I think there is a question in the chat box. Does Moringa kill cancer cells? Again, there is some data to say this, but then I think see most of these drugs which come into the market, they all go through a phase very stringent clinical trial of phase one, phase two, phase three, done in small number of patients and then larger number of patients, and that's when these drugs come into the market. So it's certain anecdotal reports and certain alternative forms of medicines may show a benefit in certain individuals, but to use that as an as a drug for cancer is still early days. And then there is data for this curcumin, what we say, turmeric. There is also some data for that. But again, this can be, these are all adjuvants or additional supplements which can be used, but may not be a single, may not be the only sole modality to treat cancer. How bad is Ajinomoto? You did mention when you mentioned lifestyle. Yes, it's also called monosodium glutamate. And if you see, people in Japan are more prone to stomach cancer, probably because of significant use of Ajinomoto. So all your gobi Manchurian and all the fried stuff, the Chinese stuff may have Ajinomotos. It's important to look at reducing the intake of monosodium glutamate, also called Ajinomoto in common. Is cancer still curable when it has reached the advanced stage? That's a difficult question to answer, but what I can say is with the advancement of treatments, including the magic bullets, the targeted therapies, what we're seeing is these patients live long, great quality of life, and we are seeing certain subsets of stage 4 cancer who live quite long, more than even 10 years in certain situations. It's probably adding life to patients with stage 4 cancer. Curable may not be the right word to use for these very advanced cases. And that's where the concept of screening comes up, and we have to diagnose cancer early. And so that way we are able to cure a vast number of patients. You mentioned late pregnancy as one of the reasons for breast cancer. Could you tell us more? Also, you mentioned about the support group that CPOM provides. Are these support groups free and online? Yeah, great questions, ma'am. So late pregnancy, yes, more than 30 years, first pregnancy over the age of 30 years is a risk factor for breast cancer. But everyone who has a risk factor need not develop cancer. So there are certain passenger mutations and driver mod mutations, what we say. Risk factor leads to a mutation, a genetic defect. And in most situations, it remains as a passenger and it remains dormant and does not cause cancer. But in certain situations, the passenger mutation becomes a driver, and that's when you can get cancer. So, yes, late pregnancy is one of the reasons for breast cancer, but not everyone with late pregnancy will have a breast cancer. And yes, we have our videos are all available online on cpoem.org. And whenever there's a support group program for a particular malignancy, it will be available on the CPOM website. And Anyone can access it, and it's all free. There's nothing, it's not charged for anything. There's no fees for anything, any of these. How does vaccinations should be taken for How often vaccination should be taken for cervical cancer? So generally, for there are various variants of cervical cancer vaccine, and you should probably consult an infectious disease expert. And some of them come with 2 doses, and some of them come with 1 doses. There's a quadrivalent vaccine, a bivalent vaccine, and we can definitely children, girls in the age group of 9 to 26 should be taking the cervical cancer vaccine.
I think we have a question from Miss Sangeeta. Go ahead, ma'am.
I think they are muted. I don't know why they're not able to ask. Okay. Is cancer treatable? Is cancer treatment very painful? This is again a myth. There's absolutely no pain with cancer treatment. You talk about surgery, anesthesia takes care of all the pain. And you talk about radiation. Radiation, there's absolutely no pain. It's just delivering X-ray beams. Talk about chemotherapy. We have excellent ways of delivering chemotherapy, though it is IV. We have devices called chemoport, which is under the skin, and there's no prick on the skin at all. So it's absolutely painless. And the side effects are also many minimal. These days, we have better deliveries of chemotherapies, better chemotherapies, and also, like I said, targeted therapy and immunotherapy.
Dr. Vishwanath, so Sangeeta ma'am has told me her question. So she asked, what is the relation between autoimmune disease and cancer?
Yeah. So, yes, there are certain autoimmune diseases, for instance, rheumatoid arthritis. These autoimmune conditions can lead to certain cancers like lymphoma, which is a disorder of the immune cells. Yes, there is some association of autoimmune conditions with certain cancers like lymphoma. But like I said, lymphoma in a vast majority of patients is curable. Next question is, does cancer treatment make you mentally down? The whole idea of these kind of talks is to say that we are all there. And yes, there is always any diagnosis, there is an initial phase of denial, and then there's a phase of acceptance. So when there's a phase of denial, that is where we as healthcare professionals and we have several counselors, psychological counselors, who can all help you. And we have support group programs to help the individual to tide over this crisis, and to also help the caregivers through this emotional turmoil which they're facing.
Do we have any more questions? All right. If there are no more questions, then I believe we can conclude this session. On behalf of everyone, I would like to thank Dr. Vishwanath. Thank you so much, sir, for sharing your valuable insights on cancer, its treatment, its prevention, as well as the common myths. Thank you for dispelling those myths. I think it's very crucial to have those conversations because there's a lot of hysteria, regarding the topic. And like you mentioned, there is a lot of stigma. So it's very crucial to have this conversation. Your expertise has been incredibly informative, and we appreciate you taking the time to answer our questions. So, a huge thank you to Dr. Vishwanath and the CPOM Foundation for an enlightening session. And thank you, dear parents, for joining us today. Your participation is greatly valued and greatly appreciated. We will be circulating a feedback form, and we would request you to fill out the feedback form whenever possible. Thank you so much.
And what I can also do, Natalia, is to share the recording with you in case anyone is interested, and they can always listen to this.
Sure, sir. Thank you so much.
Thank you. Thank you so much.
Thank you, everyone.
Thank you.